healthcare system. Sicko was number 9 on the top 10 box office draws this weekend, but the movie is being criticized by some who accuse Moore of playing loose with the facts. Michael Moore will join us here in the Situation Room in just a moment, but first, a reality check from our chief medical correspondent, Dr. Sanjay Gupta.
Sicko throws some hard punches at the United States healthcare system, and it seems just about everyone has something to say.
Moore was spot on.
The facts, I think, support what I believe.
And Moore presents a lot of facts throughout the movie, but do they all check out? Keeping them honest, we did some digging, and we started with the biggie. The United States slipped to number 37 in the world's healthcare systems. It's true. 37 is the ranking according to the World Health Organization's latest data on 191 countries. It's based on general health level, patient satisfaction, access, and how it's paid for. France tops the list. Italy and Spain make it into the top 10. The United Kingdom is 18.
Hello?
Moore brings a group of patients, including 9/11 workers, to Cuba and marvels at their free treatment and quality of care. But hold on. That WHO list puts Cuba's healthcare system even lower than the United States, coming in at number 39. Moore asserts that the American healthcare system spends $7,000 per person on health, whereas Cuba spends $25 per person. Not true, but not too far off. The United States spends $6,096 a year per person versus $229 a year in Cuba. And astronomically more money doesn't mean far better outcomes. In fact, Americans live just a little bit longer than Cubans on average. So Americans do pay more. But the United States also ranks highest in patient satisfaction. And Americans have shorter wait times than everyone but Germans when seeking non-emergency elective procedures like hip replacement, cataract surgery, or knee repair. That's not something you'll see in Sicko, as Americans tell their tales of lack of coverage and suffocating red tape. It's true that the United States is the only country in the Western world without free universal access to health care. But you won't find medical utopia elsewhere. The film is filled with content Canadians and Brits sitting in waiting rooms, confident care will come.
So I went across
But in Canada,
to a
you
crowded
could be
hospital
waiting for a long time. A survey of 6 industrialized nations found that only Canada was worse than the United States when it came to waiting for a doctor's appointment for a medical problem.
That's the reality of those systems. There are quotas, there are planned wait times, the concept that care is free in France and Canada and Cuba, and it's not. Those citizens pay for health services out of taxes, and as a proportion of their household income, it's a significant number.
It's true that the French pay higher taxes, and so does nearly every country ahead of the United States on that list. But even higher taxes don't give all the coverage everyone wants.
15 to 20% of the population will purchase services outside the system of care run by the government.
So there's no perfect system anywhere. But no matter how much Moore fudged the facts, and he did fudge some facts, there's one everyone agrees on. The system here should be far better. Dr. Sanjay Gupta, CNN, reporting.
And earlier I spoke to Michael Moore about criticism of his new film. Michael Moore is joining us now from Detroit. Michael, thanks very much for coming in. You want to respond to anything we just heard?
Yeah, I'd like about 10 minutes to respond to
well, give us a couple headlines, what you'd like to say.
I don't talk in sound bites, so that report was so biased. I can't imagine what pharmaceutical company ads coming up right after our break here. But, you know, why don't you tell the truth to the American people? I mean, I wish that CNN and the other mainstream media would just for once tell the truth about what's going on in this country, whether it's with health care, I don't care what it is. I mean, you guys have such a poor track record, and for me to come on here and have to listen to that kind of crap, I mean, seriously, I haven't been on your show now for 3 years. The last time I was on, you ran a similar piece about Fahrenheit 9/11 saying, oh, this can't be true, what he's saying about the war, how it's going to be a quagmire, the weapons of mass destruction, you know, and why don't you start off actually with my first appearance back here on your show in 3 years and maybe apologize to me for saying that 3 years ago, because it turned out everything I said in Fahrenheit was true. Everything's come to happen. Everything I said, I mean, I took you in that film to Walter Reed Hospital. And it took 3 years before you or any of the rest of the mainstream media would go to Walter Reed Hospital and see what was happening to our troops. So for me to have to sit here and listen again to more crap about socialized medicine or how the Canadians have it, you know, worse than us and all this, all the statistics show that we have far worse health care than these other industrialized countries. We're the only ones that don't have it free and universal. And, you know, you said that Germany was the only one that was better than us in terms of wait times. The Commonwealth Fund last year showed of the top 6 countries, we were second to last, next to Canada. It showed that Britain, for instance, 71% of the British public, when they call to see a doctor, get to see the doctor that day or the next day. It's 69% in Germany, it's 66% in Australia, and you're the ones who are fudging the facts. You fudged the facts to the American people now for I don't know how long about this issue, about the war, and I'm just curious, when are you going to just stand there and apologize to the American people for not bringing the truth to them that isn't sponsored by some major corporation? I mean, I'll sit here for as long as it takes if you can do that
just
for
to be
me.
in fairness, we had a lot of commercials for Sicko that we've been running on CNN as well. So, you know, we have commercials. This is a business, obviously. But let's talk a little bit about one of the
you have a nightly medical report. You have something called the Daily Dose. I watch CNN. You have it every day. The Daily Dose, sponsored by fill in the blank, and you are funded by these people day in and day out. Don't even compare that to my movie being out for a couple of weeks and a couple of rinky-dink ads for 15 seconds.
I don't know if you're familiar with
Come on, Wolf.
I don't know if you're familiar with Dr. Sanjay Gupta's record, but I would